Good afternoon, Dr. Stephen. My name is Ling Yi Jane, and my group mates are Chia YONG and me, and SHUEN. Today, we are going to present about the title of TPB, which is also known as Theory of Planned Behavior. The content we are going to present about are the introduction of TPB, the diagram of it, the intention to stop smoking in three components, which are attitude, subjective norms, and perceived behavioral control. Theory of Planned Behavior, also known as TPB, was developed by Eisen, while before this theory was developed, there was another theory called TRA, Theory of Reason Action, was together developed by Eisen and another social psychologist called Fishburne in year 1975. While TPB was actually explained about human behavior, whether the person have a strong or weak intention and behavior towards a particular object in three different components, which are attitude, subjective norms, and perceived behavioral control. For example, if the person thinks that exercising are beneficial towards him or her mental and physical health, therefore, the person will start planning a lot of physical activities and mark it as his or her daily routine to start to work on it. Next, I would like to present about three components in TPB. The first one is the attitude. Attitude actually is an individual's positive or negative evaluation in engaging of a behavior. Besides, it also individuals' belief whether that person can produce a desirable or undesirable outcome. The second one would be subjective norm. It's actually a social pressure that a person perceives to participate in or avoid in social conducting activities, and it also represents the impact on important people all around in their living. And the third one will be perceived behavioral control. Actually, humans believe that they have the ability, can control their own behavior, and it actually influenced by two main factors. The first one will be external and internal, such as our supporting system and resources, as well as our ability and drive. Now, let's move on to the diagram. The diagram shows that the three core elements of TPB and their interrelationship. The three components that affect a person's attitude are actually their behavior, subjective norm, and perceived behavioral control. While these three factors are actually the most important one and also the key factors that work together to shape a behavioral intention, which is the key determinant of actual behavior.
In the context of quitting smoking, an attitude refers to a person's idea about possible advantages of quitting smoking, as well as any perceived challenge in the process. They have two types of attitude, which are positive attitude and negative attitude. For positive attitude, when a person feels that quitting smoking would result in better health and getting lower risk of disease and finance saving. For example, many smokers are aware that quitting smoking can reduce their chance for getting heart disease and several types of cancer. Nowadays, for the price of cigarette is very high, so the smoker will have a high cost need to purchase the cigarette. So when they're quitting smoking, they will reduce their cost and have a finance saving and themselves and get the higher quality of life. However, not all smokers are positive about quitting. Negative attitude may develop if a smoker believes that quitting would result in severe withdrawal symptoms, increased stress, or likely weight gain. Many smokers use smoking to release their stress. By quitting smoking may be perceived a loss of sources of comfort. Medical professional has an important role in solving the negative view by educating smoker on healthy way and option for quitting. The medical professional can give some counseling and encourage them have a positive mindset to help the people manage their withdrawal symptoms.
Next, let's move on to subjective norm. Subjective norms are the societal pressures that an individual experience about a behavior. In these examples, quitting smoking. These standards represents the impacts of families, friends, and society on an individual's decisions to quit the smoke. If smokers believe their loved ones, such as their families or friends, which have strongly opposed smoking, this will increase their motivations to quit the smoke. The first is the support from families and friends. Family members and close friends help create a positive environment to stop smoking. For example, if a smoker's family members or friends have successfully stopped smoking, or if they publicly encourage the smokers to do the same, it might boost the individual feelings of social duty and drive them to quit. Besides that, social support from loved ones, especially those who are ex-smokers or health conscious, might boost a smoker's desire to stay committed to beneficial behaviors and increase their chance to quit the smoke. In a survey of 3,000 respondents, there have 29% of them have said that the main motivations to quit the smoke was the support of their friends and also the families. Additionally is the parental motivations. Many smokers feel pressures to set a positive examples for their children, which is an effective incentive to quit the smoking. For parents, the desire to protect their children from the harmful effects of smoking and secondhand smokes can produce a powerful subjective norm to encourage them to quit the smoke. Being awareness of family members' well-being and health, especially in youngsters, can strengthen their motivations to stop smoking. Moving on is the societal and public influence. On a larger scale, public's views against smoking have changed dramatically in recent years. Public health campaigns, smoking bans in public areas, and general societal disapproval of smoking have all added to external pressures on smokers to stop. Anti-smoking efforts frequently push messages emphasizing smoking bad impact on both personal and public's health. For example, many advertisements emphasize the dangers of secondhand smoke, highlighting how smoking may hurt others in close contact with the smokers. This cultural message generates a normative expectations that smoking is dangerous and should be avoided, which reinforcing subjective norms that which is supports quitting smoking. Lastly, for the subjective norm is the medical professionals' influence. As authoritative figures and professionals in the field of health, doctors are often regarded as trustworthy for their opinions and recommendations. When doctors advise patients to stop smoking, the patients are more likely to believe the doctors is looking out for their health and are therefore more likely to be influenced to increase their intentions to quit. Moreover, quitting smoking on the advice of a doctor may make the smoker feel like that is the right thing to do, especially if smokers are informed by a doctors about how smoking increases the risk of heart attack, stroke, and lung cancers. This professional information will increase the motivations of the patients to stop smoking and thus forming stronger intentions to quit.
Perceived behavioral control is an individual's ability to stop smoking, which includes their confidence in controlling urges and overcoming challenges to quit. So this characteristic is strongly tied to the idea of self-worth or the belief in one's ability to effectively conduct the action. In the context of stop smoking, perceived behavioral control involves aspects such as access to resources, understanding of quitting strategies, and prior efforts to quit. A smoker with strong perceived behavioral control is more likely to feel they can effectively stop smoking even when faced with difficulties. For instance, if a person has access to a variety of quitting tools, including counseling, nicotine replacement medications, or support groups, they may have higher confidence in their ability to quit. Access to these materials offers individuals practical methods for managing withdrawal symptoms, lowering the perceived difficulty of stop smoking. Furthermore, understanding the many stopping options available, like nicotine patches or behavioral treatment, might help the smoker feel more in control of the quitting process. A key motivation for perceived behavioral control in quit smoking is understanding the serious health dangers connected with smoking, especially its relation to cancer. According to research, smoking is the main cause of lung cancer and contributes to a variety of other cancers, including mouth, throat, and esophageal cancer. Recognizing these life-threatening hazards could increase a smoker's motivation to manage their habit, knowing that quit smoking will greatly lessen their chances of getting cancer. So being afraid of these health impacts could increase their sense of control, encouraging people to use all available resources and methods. Previous quit attempts might also change perceived behavioral control. A smoker who has previously attempted to stop may be more prepared for the obstacles of the process, having learned effective techniques to control cravings and stress. Individuals with little perceived behavioral control may feel overwhelmed by the problems of quit smoking, such as fear of withdrawal symptoms, increased stress, or societal pressure. This might reduce their drive to stop because they feel it too tough to attain. So health practitioners may help smokers feel more in control by teaching them appropriate coping methods for controlling cravings and providing support services that address both the psychological and physical elements of quitting. So reinforcing self-efficacy by phrasing a little accomplishments such as lowering the number of cigarettes smoked per day or controlling urges might help a smoker gain confidence in their capacity to stop. That's all from our group. Thank you.